no longer silent, patient access stories.
The moment you feel uncomfortable, you feel unheard, you feel written off, that is a sign that you possibly need to look for another healthcare provider.
We are getting loud with a true rock star. We're welcoming Sharon Washington from Change for Shawn. She's an entrepreneur and an advocate for social change. Are you a Black woman?
Yes, I am a Black woman.
Are you a breast cancer survivor?
I am not a breast cancer survivor.
And I guess I should ask, have you been diagnosed with any type of cancer?
No, I have not personally been diagnosed with any form of cancer, but I do have family members, both my maternal and paternal grandmother, both were diagnosed with breast cancer, one of which has passed away.
Oh, wow. So we might keep your information for another conversation for another day.
Yeah.
Yeah. So, wow. Sharon, thank you so much for being an advocate. I mean, you are the poster child to what it means to be a consummate advocate. You're advocating on behalf of your late brother, Shawn.
Yes.
Tell us Shawn's story.
Yes. So Shawn was a 29-year-old father-to-be who unfortunately lost his life due to what I believe is systemic racism in healthcare and medical negligence. So in 2019, in the month of April, Shawn visited 3 different healthcare facilities, all of which did not give him the level of care he required. On April 2nd, he visited a Northern California ER, and he was having symptoms of a cough and a fever. No blood work or x-rays were done at this time. Shawn was told he had bronchitis, given some cough medicine, told to follow up with his primary care physician in a few days. Unfortunately, he was a typical male who didn't regularly or didn't always go to the doctor, so he didn't have a primary care. But he did his due diligence and he followed up. On April 21st, he went to a urgent care. And at this urgent care, he was presenting with those same symptoms of the cough, the fever, but he had now developed some white sores in his mouth along his gums. And he was complaining of that. He was having trouble eating and swallowing because of the pain. Again, no blood work, no biopsy of those sores, no x-rays. Shawn was given antibiotics and sent home. In a few more days, on April 24th, he visited a dentist, and because the sores in his mouth had gotten that bad. And again, no blood work, no biopsy. He was told to visit the oral surgeon across the street this same day, and they told him that it looked like he had a rare fungus. He was given more antibiotics and sent home. The very next night, around midnight on April 25th, 2019, Shawn began coughing up blood. It just so happened that my mom and all of her 5 sisters and my grandmother and my sister were all out of town. I was living in the Bay Area at the time. And so my brother called his girlfriend, who was pregnant at the time. She rushed over to the home, saw how ill he was, and they decided to call an ambulance because he knew that he would be seen quicker and he was scared. And so the ambulance took him over to the same ER that he visited on April 2nd, earlier that month. He arrived through the ambulance bay at around 1:15 in the morning, and they began running blood work. It came back about an hour later that Shawn was septic, and he had a 0.01 white blood cell count. His chief complaint was, though, coughing up the blood and having trouble breathing. Shawn was then allowed to sit in their emergency room for over 8 hours as he coughed up over 8 vomit bags full of blood. I arrived about 5:15 in the morning and was told that Shawn should be getting transferred to another facility where specialists were waiting for him, because this particular facility did not have any specialists on hand. And so they couldn't run all of the testing that was necessary to figure out what was wrong with him. As they were waiting for before they actually ran blood work on Shawn, he was questioned multiple times and badgered about intravenous drug use or having AIDS. And he denied every single time. His pregnant girlfriend was sitting right there. My brother has never used drugs in his life. Yet they delayed giving him the sepsis medication and decided to test him for AIDS anyway, and delayed his care. Even noted in his chart that they badgered him about intravenous drug use. And then I was told once I arrived that they would not be transferring him to that facility where the specialists were because they could not get in contact with his insurance provider. I was asked on more than one occasion to go home because my brother left his wallet at home on accident. But I was asked multiple occasions to go home and get his wallet. And I refused and let the medical staff know that they needed to treat him regardless. And that they could bill us later. But that is why they didn't transfer him. He was also supposed to be sent down to ICU because he was so critical with his white blood cell count being so low. And that never happened. Shawn sat in the ER for 8 hours as he constantly coughed up blood. And he struggled to breathe. He went from being able to talk to being unable to talk, to saying that he could feel blood when he went on in his airway when he took a breath in and out now. The facility was understaffed. And so the doctor was very busy. He was seen by 3 different doctors, all of which left without telling us they were leaving. But ultimately, Shawn asked 3 times to be intubated, and he was denied every single time. And then they finally decided to intubate, and that took about an hour because nurses were outside of our room discussing if they should call down to anesthesiology now or wait until 30 minutes until they were off shift and let the next shift handle it. By the time they finally intubated Shawn, my grandpa arrived, and uncle had arrived, and his girlfriend was still there. We were in the waiting room. We were told it would take about 20 minutes. About 40 minutes goes by, and I'm then called into an empty triage room, and they asked me to sign some paperwork. My mother was not there yet. She was on a red eye at the time. And I was, I guess, signing to be his spokesperson and as his next of kin. And about 5 minutes later, after signing that paperwork, my entire family that was there was brought back to that same empty triage room. And we were told that when they went to intubate, Shawn's heart caught a rhythm and that they were now doing CPR. My family ran in the room and prayed over him. But ultimately, Shawn lost his life at 8:21 a.m. on April 26th. At 29 years old, with a daughter on the way that he unfortunately never got a chance to meet, with a mother who never got a chance to tell her only son goodbye, and the youngest sister that had to watch her very best friend and idol lose his life.
I am just going to pause for a second and just really give both of us a moment to just exhale. So you have been telling this story since 2019.
Yes. Yeah.
And the level of intensity that you still tell this story speaks to the lack of justice that you feel that your brother's life and case has received.
Yes.
May I ask how old you are?
Yes, I'm 31 at the time. What? What's the math?
No, that makes you at 27?
Yeah, 26, 27.
26, 27?
Yeah.
So, any more siblings?
Yeah, so there's the 3 of us. Shawn is the oldest, Sherelle, the middle sibling, and I am the youngest.
Okay. And was Sherelle there as well?
Unfortunately, no. So my family runs what's called a college bound program. My aunt is the CEO, and my family all staffs it. And so they were away on a college tour, and my sister happened to be away on like a trip with her friend out of town as well.
Yeah.
So it was almost like the perfect storm, and I truly believe that it was nothing but God, because my mom, she would not have survived being there. I also know that the work that we've been able to do since my brother's passing would not have been able to be done if I wasn't there. And so it's a burden, but it's also really a testimony and a blessing that God thinks this highly of my brother to want to use his life and his legacy to help others.
Yeah. And so I was asking those questions to just kind of set the stage around the type of support you had in the midst of this very traumatic, less than 30 days watching your brother's decline, health decline, and in essence, about 6 days from the time that he had gone into the urgent care, then went to the dentist, and then going back to the ER. Last week, I was on a policy call with some fellow advocates and a physician, and we were talking about this very topic. And the physician talked about, of course, from the physician's perspective, talked about the stress and duress with which doctors are under right now because COVID played such dramatic and traumatic role on our healthcare system. And so under no circumstance am I giving any excuses for what happened to your brother. I do want to unpack from your perspective and your lens. What are your thoughts around what happened to your brother? And hearing me say, a doctor said that, part of the problem that patients are not receiving quality care is because of the overwhelm that physicians are facing.
My thoughts when it comes to my brother's passing is that access to quality care is not a given, and as it should be. And unfortunately, there are medical facilities that are operating as corporations and are putting profit ahead of patients. And I believe that's what happened to my brother. Here he was, a Black male, left his wallet at home with a pregnant girlfriend, with a 0.01 white blood cell count. And to me, he was written off. He was seen as, not worthy. His Black life was seen as less than valuable. And that has to change, whether it's, due to unconscious biases, whether it's due to conscious biases, whether it's flat out racism, whether it's circumstances that the doctor mentioned that the medical staff are working under, whether it be understaffed, underpaid, overworked, or facilities that just don't have the resources that our health sometimes requires. So I believe that my brother's passing was completely preventable. I believe that had he been taken serious the very first time he visited a medical facility, this would have been caught. Sepsis doesn't happen in a matter of just 2 days. You don't lose thousands of blood cell counts in just 2 days. This was happening over time. And Shawn did his job. And unfortunately, it's my belief that the medical professionals didn't exhaust all cause and effort to save his life. And then to answer, what that doctor said, my brother passed before COVID. And medical negligence and systemic racism in healthcare has existed since the beginning of healthcare. For anybody that's unaware, gynecology was started based on the inhumane practice on Black women without their consent. And so this is a long-standing history. And so though what he said is valid, doctors and nurses and staff are working under conditions that are insane, deplorable, and that they should not be working, under. And this problem did not just start with COVID. And unfortunately, it did not end with COVID. And so something has to give, whether it's within the training, whether it's within the resources, whether it's within the hearts of those that are actually doing the work, because that's really what matters at the end of the day. You can have top-notch medical facility and still not have the heart to care for each and every patient that comes in, despite their race, despite their insurance status or any other factor, right? So those are my thoughts on that.
Sisters, listen. Oh my goodness. So when you started responding, I was waiting. I wanted to hear authentically what you said, but I asked that question specifically because that was a question about post-COVID, and what we know is the situation that happened with your brother happened in 2019, and you went all the way back to Henrietta Lacks.
Yes.
I know. Come on now to Henrietta Lacks, right? And her
dots.
That's right. Her cancer tumors were taken and being experimented on without her knowledge and or her permission, and her family is still fighting for justice to this very day. So when you went all the way back and did the loop and talked about the complexities of healthcare from the beginning, that we meaning Black people, period, were never part of the thought process for saving our lives. And people will argue it, but we live it and we see it even today. And I often ask that doctor, that doctor and I disagreed on many things throughout that that session. And and I ask, well, what is the cost of a life? Right? Because they always want to put a dollar amount on insurance or whatever the tests are and things. And we'll get over to your website and your toolkit in just a second. But they always want to divert the responsibility on who, what, when, where, and how they should care for all people, especially Black and brown people. Because I agree that I believe that your brother could be alive today had he received quality, equitable, timely care in the face of a crisis, whether or not he had his wallet. If you said, okay, just bill us and we'll deal with it on the other side, just take care of my brother. And kudos to you for having the acumen to be able to have an advocate, have the vocabulary to advocate for your brother the way that you have just shared with us that you advocated for him. And kudos for you, to say we won't stop until we get justice for Shawn's life. As a result of all of this, you and your family fought to create some legislation and get some legislation put into place. Tell us about that.
Yes. So we didn't necessarily create it, but we were a part of the initiative for the Fairness for Patients Act. And so what that bill basically did was it dismantled some of the predatory laws, one predatory law that has been in place since 1945. And so that is the Medical Injury Compensation Reform Act. Enacted in 1945, medical facilities paid politicians to lobby on this law, because what it did was lowered the insurance rates of these medical facilities. In turn, they put a 1-year statute of limitations for filing medical negligence cases in California, as well as a $250,000 cap on the amount of compensation that families could receive in medical negligence cases in California. And so what you saw as a result of that law is that a lot of these medical negligence cases were being swept under the rug and not having the opportunity to seek justice, because in medical negligence cases, you also have to hire medical experts to speak on your behalf to point out the neglect that actually took place that led to the injury or passing. And that takes thousands of dollars outside of court fees. And so lawyers are not eager to take these cases because they're afraid that they won't be compensated fairly. And what you see is folks who look like me and you in the Black and brown community don't have the funds to just pay for it ourselves. And so you see this disproportionate effect on different communities, whether it be based on race or finances. And so this law, the initiative, the bill, Fairness for Patients Act, it got rid of the cap. So now families that file from 2022 and on have a better chance at actually finding a lawyer and seeking the justice and the accountability that they feel like their loved ones, deserved. In my opinion, that was one form of dismantling systemic racism because, like I mentioned, it had a disproportionate effect on the Black and brown community. And so we were able to be a part of that. We were able to use Shawn's story and legacy to leverage with some of these politicians and worked firsthand with the lawyers that were writing the policies. And so I can proudly say that, my brother's, life was not in vain, and that now others will have a better circumstance in their situations.
We want to pause for a moment to thank our platinum partner, Amgen. Amgen has been a consistent partner who not just talks the talk, they fight hard to illuminate voices and experiences of diverse patients. We're truly thankful for such a beautiful partnership. This conversation is also activated by Genentech and Change for Shawn. Thank you to all of our partners. That is so profound. And kudos to you and all who participated with that legislation. I know with the work that we do at Carrie's Touch, so many times we see situations where I am clear that it is medical negligence, or a more common term is medical malpractice. And a challenge that we have run into in the past when there were patients that felt that their medical team had been negligent, is that when you said that you have to have medical professionals to testify, it's not only paying for the lawyers, it is getting a physician who's going to testify against another physician, which creates a whole nother level of complexity for that physician that actually testified.
Yes, so it took us almost 3.5 years to find a physician that was willing to testify. Multiple physicians reviewed my brother's medical records and pathology report and found neglect, but were unwilling to testify. We finally got one that was willing to testify. And, and so, yes. And that there's thankfully we were a part of one more initiative regarding the medical board and how the medical board complaints work. And like you led to that with, the medical board is made up of other doctors. And so it's doctors policing doctors. And as you mentioned, we see how that goes. And so we were a part of a bill that reformed the way that they process medical board complaints, to where now they take a patient or a family impact statement and they must speak to a family member before they close or carry out their investigation. And that's important because they should be able to see it from both perspectives. And so that just another thing that we were gratefully able to be a part of. So are you aware of whether or not this bill or this legislation that you've worked on has carried over into other states throughout the country? I believe it affects, so the reform to MICRA, I believe, also affected Nevada. I don't know that the medical board has changed because that differs as well. But I do know that it did change the circumstances on the amount of compensation for Nevada as well, I believe. I have not heard of, and it could just, be lack of knowledge on my end, but I've not heard of any changes in other state legislation yet. Not to say that, like I said, it isn't happening. I would love to be a part of it if, for where it is. Yeah, I haven't just yet heard of the wave, but I do know that there's a wave, and I'm hoping that other states begin to catch on as well. And there's still, the year statute is still in place. That to me needs to change as well. So there's still some things that need to be done for sure. Yeah. Well, one thing, and others that are listening might disagree, but one thing that I love about living in California is that we are very progressive. Yes. And we are often the leaders in making major national changes, for other states. Now, we know that there's always going to be the conservative states that don't care about whether or not we live or die, and they make that prominently known every single day, every step of the way.
But for those of us who live here in California, we're grateful to you and to your family for the work that you're doing at Change for Shawn.
Thank you.
Tell us about Change for Shawn, and that's change, the word change, the number for Shawn, SHAWN.com.
Yes. So Change for Shawn is a public health organization, nonprofit, that my family and I started in 2020 after my brother's passing. We had just realized that we were not the first, and unfortunately, we're not the last. And because it took us a long time to find a lawyer and representation, we learned a lot on our own. And, I acted as our lawyer for 2 years. So we were pro per. And so I just learned a lot. And I wanted to be able to share that knowledge and be a support to the other families that would be, going through this experience as well. And so we started out as, just sharing Shawn's story and just making sure we were educating the community on what their rights are, how to advocate for themselves when they're in medical facilities in the moment, but also how to navigate the judicial system and seeking justice and preparing themselves for what that journey is going to look like and all the things that they need to gather before they begin looking and searching for representation. And so we now are a full-on advocacy organization where we work with families side by side and help them advocate for their loved ones who have either passed or been injured due to what they believe is medical neglect as well. And so we're currently working with 5 families that have lost a loved one. And we're literally on the phone helping them get medical records. We're filing medical complaints on their behalf. We, have a advocacy toolkit on our website where you can go on and you can see quick responses and things that you should know and be aware of every time you step into any form of medical facility. And so we're really just a helping hand. You can call us, email us if you have questions. We have a short intake form on our website. But we're really just a stepping stone, and our org focuses on advocacy, education, and empowerment of our community, whether that be, supporting a family, lobbying for policy change, or, sharing others' stories.
Wow, beautiful. And so I checked out your toolkit and I thought it was just like top notch, just quick. What seems to be simple for us now that we have gone through the journey,
Right.
But is often very, very difficult for other people. And you've simplified it and made it easily accessible for folks to go on. And one of the things that, when you talked about signing that paper, for your brother, it was either an advance directive or a healthcare proxy is what they're typically called, right? And so, and with the advance directive, it's either a living will or what's it called? Durable power of attorney, right? Mm-hmm. Those are terms that we know because we've been through this personally and with other families.
Exactly.
But the everyday person does not know about an advance directive. Most of us are offered an opportunity to sign an advance directive when you're admitted into a hospital, but most of us decline because we don't know what it is. Exactly. And if we are looking at some next legislation, no, I'm not putting anything on your plate, but the next level of legislation really needs to be awareness and education around what an advance directive is. And let's just be clear, Black folk, we don't want nobody in our business. We ain't telling them all of that. But somebody being able to speak on your behalf could save your life. And if you don't know what that tool, that piece of paper is, it can turn out to be deadly. And unfortunately, that's why you're even here having this story. So I applaud you and your family, and I'm thankful to you and your family for your toolkit and being able to just put it's simple. It's not complex, y'all. It's not all of this. Go on their website, Change for Shawn, the word change, the number 4, the SHAWN.com. Go on their website and just look at this, what I think is 9 quick tips and tools that could help either save your life or help you to be a better advocate for things that you want. Other things on your toolkit is that, and I'm sorry, can you tell I'm a little hype about your
Yeah,
toolkit?
no,
The
I
other, the
that.
other thing that I'm hype about your toolkit is that you give people permission to fire their doctors.
Yes.
Folks stay in bad relationships with doctors that don't see, hear, respect, or value them and or their lives, and they complain about how bad their health care is when you actually have the authority, legal authority, to fire anybody on your medical team that
Yes.
is not giving you the type of service that
Yes.
you think that you deserve. Now I'm gonna let you say something after I do this last little pin. I'm sorry. Now, y'all that are listening, you can't go in there being troublemakers and being, you know,
Yep.
SHIT starters and expect to say, okay, well, I'm firing you, I'm firing you, I'm firing you. Because if you fired 10 people, it might be you. It might be. I'm just saying that you do have the legal power and authority
Yep.
to fire a medical health professional. Go ahead,
No,
Sharon.
I appreciate that. And you took right into what I was going to say is that there's a certain way to go about having those conversations. There's a way to be assertive. I work with children. I'm an educator. And so we use a term that's called kind and firm. You don't have to cuss nobody out. Sometimes you may have to now. Okay, let me just say that. But in order to initially get what you want, sometimes you don't have to do that. You can be kind with your words and be firm and assertive at the very same time. And so what I wanted to do was quickly give an example of that and use myself. So I've actually had to let go of 2 of my OBGYNs. I unfortunately dealt with a miscarriage in 2017, and my husband and I have struggled with conceiving since then. And so I had an OB that said, okay, you have a cyst on your ovary. We need to have that removed. I'm probably just going to go ahead and take the whole ovary. And I'm like, oh no, excuse me, that sounds a little extreme. I don't want you to take my entire ovary. And she's like, okay, well, when we get in there, we can, if we see there's some damage, we'll have a contingency plan. We'll come out and ask your loved ones. And I said, no, there's no need for a contingency plan. I, your patient, and am right now in of sound mind, letting you know that you will not be removing my ovary. That's all you need. And she did not listen. I did not cuss her out. I did not tell her. I didn't even have to tell her right then in the moment. If you feel uncomfortable saying you were no longer on my service, you're fired, you don't have to say so. One of the luxuries of, the things that we do have, if you have insurance, is you can go online, you can call, and you can change your doctor. So I was able to do that online. I just made an appointment with a new doctor after doing some research. Now, got to this new doctor, found out that I had, needed to have a dye test on my fallopian tubes. It's called an HSG test. The test results said, oh, it looks like you have a blockage in your right fallopian tube. The doctor came, this is my new doctor now. She comes back and she says, we're just going to go and take your right tube. I said, oh, no. Can we send those results to a specialist? At the time, I didn't have insurance to see a specialist. So she sent my results to a specialist. Specialist comes back and says, I actually think the right side is fine. I'm concerned about the left. My doctor says, never mind. We're going to take the left instead. I said, no, thank you. Sounds like the test is inconclusive. We should probably order another one before we do any removal type situation. I then felt uncomfortable. I didn't have to communicate to her. The moment you feel uncomfortable, you feel unheard, you feel written off, that is a sign that you possibly need to look for another healthcare provider, or have the conversation if you feel comfortable that that how they're making you feel. I felt uncomfortable, changed doctors. I'm now with a new doctor that I love, redid the test. The left tube is fine. The right tube does have the blockage. But if I would have stayed with that doctor and just took, oh, she's the doctor, she has expertise, and not trusted my body and my gut and my heart and God, I would be left infertile because she would have took the good tube. And so that's just an example of how to go about those situations, how to stay calm, but also to know to trust yourself. Nobody knows your body better than you do. and you want to find a doctor that is willing to listen to you.
Wow. I mean, you are fierce. You are just fierce and phenomenal. How did you become such a fierce advocate? I don't want to minimize your age at all, but I want to acknowledge
Yeah.
that you don't find fierce advocates on your level at your age. You know, I celebrate you. I applaud you. I admire you. I am inspired by you. Give us the tea. How did you become so awesome?
Honestly, it is only God.
Mhm. Yeah.
I was doing social justice work back started in 2015, leading protests, having conversations regarding, the policing state and in the United States, just the detriments to the Black community, big, large, small. And so I was already doing the work, but I just say that was God preparing me for what this was going to take me to. And I know a lot of people probably wonder, like, how can I speak like this when it took so much loss to get here and it took so much trauma and PTSD and heartache to get here? But through those trials and those tribulations, through that loss and that heartache is really where I learned why God allowed me to bear the burdens that I had to bear. Because I truly believe that my brother's story, that my journey is all to just show others that they're going to come through the fire as well. And they won't smell like smoke. And, their testimony, my testimony is just to help them make it a little easier for somebody else and to shed light on God's grace and glory through what I've been through, because I can still say God is good. And so it is nothing but God that I was just had the family that raised me to always be outspoken and to always be that confident Black girl in the room, and the education to pair with it to make me say, oh no, I know what I'm talking about. And like you said, the age has nothing to do with what I know that I know that I know. But that is nothing but the grace of God and the mercy and protection of God.
Wow.
The common theme has been, if it had not been for the Lord that was on my side.
Yeah, 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 yeah. As you were wrapping up your story, I got just so excited with, hearing the testimony of the outcome with regard to your leftover being fine. And, had you not listened to your mind and your trusted your body and your heart and your intuition and God, I didn't want to miss an opportunity to extend my sincere condolences for, the miscarriage, because that too is a difficult journey, and it's part of your testimony. And I just thank you with all sincerity for who you are, and I thank your parents and your ancestors for giving you what they poured into you for these divine moments and these divine assignments. And so, what's next for you? What's next for you, Sharon? What's next for Change for Shawn?
Yes, for me, like I mentioned, I'm an educator. I work in Oakland at East Oakland Youth Development Center. I am the director of K-12 programs there. And so really personal aspect is just being able to learn more, to pour more into the youth, to uplift them, and to continue to do the work. And, hopefully y'all will be able to hear that my husband and I have had a baby within the next, year or two. We're getting, assistance with that. So God is good on that end. But with Change for Shawn, as of right now, a lot of the work that we're doing is after there's been an experience. I'm trying to push to be more proactive. And so that is why we have the toolkit, because that is proactive care and advocacy. We want to get more into policy change. We want to get more into legislation, just continue to advocate and educate our community on what their rights are, how to carry out, their rights, and just continue to build a community that loves on each other, cares for each other, looks out for each other, a community where you can say, hey, I have a doctor's appointment, who can go with me? We are currently filming a documentary that will highlight my brother's life, some of our journey, and some of the work that we're doing. And so that will be out soon, hopefully by June. We just wrapped up filming. And so that's just another opportunity, like I said, to uplift my brother's legacy while also advocating and uplifting my community. And so, yeah, just continuing doing the work, honestly, learning as much as I can, connecting, networking where I can, but really just, like I said, using my brother's life, the way that he unfortunately had to pass, to ensure that no other family has to suffer like mine has.
Wow, Sharon, that time went by so fast, so fast. And I feel like we could spend another hour together, minimum, just, all of the questions that I still have written down but I want to take this moment to ask, is there anything that I didn't ask or you feel like you want to make sure that we include?
I think a lot of the times I'm telling the story of how my brother died, but not necessarily the essence of his life. And when he was alive, my brother, his name Shawn Edward Washington II, and he was a musician. He was an artist. He was a naturalist. He lived in the woods for about 7 years, pouring into youth. And he was a father to be. His beautiful baby girl, Shanice, who we named after him, he was the best brother. He was the best son, cousin. He was insanely intelligent. I mean, insanely intelligent. I miss that. I miss my brother. He was my idol. You had asked, how did I become who I am? And it's from chasing after him and wanting to do and be able to say the things that he could do and say. He was taken too soon, and his life was valued, and it was beautiful, and he should be here. And I just hope that we learn something from this tragedy. And I hope that we continue to strive for change, and that we generate that change, and that in 10 years from now, I can say, we've done that. My brother should be here, and he's truly missed each and every day. His birthday was just this past Saturday. He would have been 34. And he should be here to see his daughter. He should have been at my wedding to have my dance. His mother should have her only son. My sister should have her best friend. And so if you all don't take anything else away from hearing this, please just know that Shawn Edward Washington's life mattered, and it still does. And if you or anyone that you love, you feel like you dealt with medical malpractice or discrimination or anything, we are here for you. Thank you for asking me to be a part of this. Thank you for being intentional about the questions that you asked and the love that you poured into me. I truly needed to hear and appreciate. So it's a blessing.
You are a beautiful human being, and I am just grateful to God for the privilege to share space with you, just even for this short little bit of time. Oftentimes these conversations are heavy because we're not talking about light, easy subjects. And so in order for us to not minimize the weight of the conversations but knowing that we still have to go back out into the world and to do other things after this, to just kind of lighten our hearts a little bit, I ask some closing questions.
Yes.
They are not deep questions. It is intended for you to answer based on what comes to your mind, just at the beginning. And so the first question is, day or night? Which do you prefer, day or night?
Day.
Vanilla or chocolate?
Chocolate.
Breakfast or dinner?
Ooh, breakfast for dinner.
What's your favorite music genre?
Oh, gospel.
And finally, what brings you joy?
Oh, my family.
My
family. Yeah. I love that. Thank you.
I just have goosies going through my body because of the gift of you. Man,
I told y'all. I tried to warn you up front. I told y'all we had to end this conversation, this part of the conversation, with this sister and this story. My deepest condolences to you and your family for losing your brother in the midst of all of this. And at the same time, I celebrate you for truly being champions of change and for fighting for justice, not just for Shawn, but for all other patients that will endure the journey that you endured. Thank you for being a brilliant representation of your family. God bless you, and may your endeavors go beyond whatever it is you could imagine. Thank you, sis. Thank you to renowned virtual photographer John Keatley and his incredible team. A special thanks to photos by A Love LLC, April Jones, Retouch Artist, and to the dedicated Carrie's Touch tribe for your unwavering support in helping us create stories that heal. And another big thank you to our platinum sponsor, Amgen. For more information about these stories and other survivor support and advocacy information, visit us at our website at www.carriestouch.org.